Making the decision to join a clinical trial is not easy. While there are many different types of clinical trials, the following program focuses specifically on making decisions relating to the use of new drugs for cancer treatment. Patients and healthcare providers offer comments and suggestions in their own words to help patients weigh the benefits and disadvantages of clinical trial participation. They explain what a clinical trial is, what the different phases of clinical trials are, how risks to the patients are minimized, and that either choice, to participate or not to participate, is okay. The program also provides strategies to help patients make a decision that is compatible with their beliefs and values.
In the future, they can see how things will work out for me, and they can find something that's even a little better. And then for me going through this, whenever it does stop working, that better would be for me. You see what I'm saying? So I'm not only helping others, but I'm helping myself.
I hope that it will be useful to other people. I hope it will be useful in designing other drugs to fight this disease and to fight other kinds of cancer.
The goal of a clinical trial is to test potentially a new medicine or a new treatment, and it's not known at the outset of the trial whether that treatment is necessarily going to be better. Drugs are not the only thing that are tested in clinical trials. There are many other things that clinical trials are used for. For instance, a new surgical technique, or a new surgical device, new ways of giving radiation treatment, new ways of assessing quality of life.
It has to be based on a rationale that seems to make sense to everybody based on what we know. In some way it's been tested before we even get to a patient that looks at its ability to fight cancer, causing tumors to shrink in animals. It may be tested using human cells to see whether it might be effective in killing off cancer cells. But all of that, which may provide tremendous promise, then needs to get tested in real-life people to see if this is really effective.
The reason clinical trials are important is they are the way that we move forward. So the reason that treatments today are better than they were 20 years ago, for example, is because we've been doing clinical trials.
Just in the same way as the medicines that we know work came out of research and clinical trials, the hope is that similarly you're going to benefit people who come after you.
By being in a course of medication, I was standing on the shoulders of people who had gone before me. They had been in trials, and let's hope enough of them did well so that the medication I was on now was a result of that.
We're making better efforts to make sure that we address specific aspects of the biology of cancer that may apply to a minority group or to an older patient population or to men or to women. It might be clear to all the doctors who together are putting the clinical trials together that in this particular case we really need to know about how this particular drug works in elderly women or how this particular drug works in African American men with prostate cancer.
The death rate that occurs in patients, African American males with prostate cancer, is very different than the death rate that occurs in white males. One of the areas that researchers are trying to understand is why the figures are so very different. I have a father and 4 uncles who were diagnosed with prostate cancer. And so to think about them finding a cure or being able to diagnose that a whole lot sooner in life is something that is in fact very important to me and hits home because of having 2 sons in my family.
Every clinical trial or every investigational trial goes through several steps in a process, and each step has different questions that are being asked.
In a phase 1 trial, the primary objective is to really find the maximum dose of a drug to be given with side effects that are acceptable. In a phase 1 trial, the secondary objective is to figure out how well a patient is responding to the therapies.
Phase 1 is often kept in certain settings for patients in whom no other treatment options are readily available.
I had gone through a whole series of operations, conventional chemotherapy. I was at the end of my rope. And when I got involved in the dosage trial, it was because I had no other options. Really, there were effectively none. Given the kind of cancer that I had, this was what there was. What you're really allowing your doctors to do is to use the information that they collect in the course of your trials to advance medical science and to help other people as well. I'd like very much for this drug to keep working for me. But if it doesn't, I do hope that what my doctors and what the researchers learn from the information that they collect as I go through these trials, I hope that it will be useful to other people. I hope it will be useful in designing other drugs to fight this disease and to fight other kinds of cancer.
Look at the choices and decide how is it going to affect you. What is your quality of life with the time that you have left going to be? And for us, it was very important. When I was on phase 1, one of my very best friends was also on it. She was a physician, and she died. But her husband and I and my wife are still friends, and her children. We see them frequently, and every time he sees me, he said, I hope that her particular course of treatment helped you live, and I hope yours helps other people live. And that's the way my wife and I and the friends that I've surrounded myself with look at that. That's the way we view it. We hope that it helps.
In phase 2, the primary goal is we want to show this drug is effective against a patient's particular cancer.
We thought of the benefits both to myself and to others who might benefit from such a study. And I'll have to admit there probably were some selfish motives in getting medication that could help me as far as treatment of my disease is concerned.
If they do get a benefit, it's terrific. If they don't, a significant proportion of the patients actually do have other treatment options we can then move to.
We've figured out the dose to give a patient in a phase 1 study. In a phase 2 study, we've figured out if that particular drug works for that tumor type. And in a phase 3 study, we're trying to assess whether or not the new drug works better than what we're currently using.
We're comparing a treatment that is already being given, that is considered to be proven, to a newer treatment. We always hope that whenever we put a patient on a study, that this new agent will offer some real-life benefit to them. But one really doesn't know whether this is really better for the patient than the treatment that's already being given.
If it works, the doctors learn something. If it doesn't work, they still learn something. And the patients coming next after you benefit.
There is always some risk involved with clinical trials, but safety is of paramount importance.
Both internationally and in the United States, a set of procedures have been put in place for institutions, researchers, to oversee the conduct of clinical trials.
Procedures are often reviewed by bodies like the National Cancer Institute, which may evaluate a drug to see if it's safe enough even to be in an investigational trial.
The Food and Drug Administration, or the FDA, approves many clinical trials. The National Institutes of Health also has oversight on clinical trials.
The Institutional Review Board is a very important oversight body that ensures appropriate conduct of research, to ensure that it's conducted ethically, morally, and to make sure that it's conducted in a way that maximizes the scientific value of the study. Institutional Review Board members include physicians, scientists, nurses, biostatisticians, lay individuals, patients, patient advocacy, And together as a group, they ensure that when a researcher or investigator makes application to an IRB to perform a study, that the study is conducted appropriately, taking into consideration all of these issues.
For every clinical trial, there's a set of eligibility criteria. If, for instance, you have a medical condition that would put you at higher risk of a complication or a potential serious side effect from a medication that's being used, you won't be able to enter into that trial.
For example, if your liver's not working quite right or your kidneys aren't working quite right, and you're given a new drug that requires your liver to change it in the body to metabolize it and your kidneys to get rid of it, then you wouldn't be eligible to be in such a clinical investigation.
We tell people very clearly that we don't want to hurt them while trying to help them, and that we hope that perhaps there'll be another way to help build them up a little bit and they might be able to try again. It's very disappointing, sometimes devastating, to hear that you cannot participate in something you have great hopes about because you're too sick, but it would not be responsible to do otherwise.
During any clinical trial, you're going to be monitored very, very rigorously along the way to make sure that there aren't any side effects that are occurring that would be potentially harmful to you.
Any phase of clinical trials, 1, 2, or 3, you're not preventing side effects, you're trying to identify side effects.
What exactly was it going to do to my body? Not only take care of my problem of multiple myeloma, but was it going to sacrifice my organs? When they relieved my fears with that and how they would keep a good eye on me and how they take blood tests to check on things and urine every 2 weeks, that was beautiful. So that kind of relieved a lot of fears that I had.
The risk primarily was toxicity to the heart, and the way my oncology team addressed that was to say, you're going to be monitored, rigorously and periodically. But over time, it was clear I was suffering heart toxicity, and we knew why I had to withdraw.
In most cases, the actual study aspects of taking part in a clinical trial are paid for, but you should be very clear about what other costs might be entailed.
When there's hypervigilance, rightfully so, during a clinical trial, more blood tests perhaps, more CAT scans, maybe surgeries, that you consider the time and the effort. And I think there's some personal costs around that, not only to you as the patient, but your family members, that need to be considered.
It's going to be important to think about what the balance is there for you in terms of cost. Time away from family, the increased burden of travel, tests, potential side effects, impacts on quality of life, time away from work when you're sicker. Is that something you really want to do? It's very, very important to remember and to realize that it's okay to say no to a clinical trial. Your doctors and your care team will ensure that whether or not you decide to enter into a clinical trial, you will still receive the state-of-the-art treatment for your disease.
Ella me explicó, ella me dio todos los informes.
Eso me parece que era un estudio nuevo, que no se tiene mucho conocimiento, no se sabía si iba a funcionar o no iba a funcionar, entonces ella decidió no.
My sense of what that meant after I said no was simply that I was totally embraced as a patient with quality care. It was simply a level of respect for a choice that was mine to make.
If at any point during a clinical trial you determine that the side effects or the increased burden from testing, for instance, is not tolerable to you, you can withdraw from the trial, and that can happen at any point during the trial. And it's okay to do that. You will still receive the standard or state-of-the-art treatment.
Patients do ask me if they're feeling really ill, do I have to continue? And the answer is no, you don't have to continue. You have the right to go to your healthcare team, to go to your doctor or your nurse and say, you know, this is not what I expected it to be. You have that right to ask that question and then to revisit your options that you have. If you don't continue on this therapy, what else can you do?
There's no reason to feel bad about the decision to withdraw or curtail participation in a clinical trial, because ultimately, again, you have to be comfortable with how you're being taken care of.
Very often our patients will bring someone with them when a decision about treatment has to be made. And that person, if at the best, is someone who has perhaps been with this patient through other decisions and knows how they think about things and what their values are. Someone else to hear the discussion and be able to talk about the issues with the patient later outside of the hospital. That can be very helpful.
I'm a nurse and a professor of nursing. The reality was I was so anxious. I had to have somebody with me all the time to really help me remember what somebody said, or would help me read something or talk to somebody to translate out the information.